I am Cale.
This is Cheryl.
I'm Kaylie.
I'm Maddie.
And I'm Taylor, and today we'll be talking to you about nursing through the eras.
This presentation is going to explain how nursing practice, leadership methods, and education has evolved throughout the years. We'll be touching on middle-age nursing, nursing methods founded by Florence Nightingale, nursing evolution through the world wars, and nursing today.
To see if you can tell which era nurses belong to based on their appearance, we created a Kahoot challenge. Just type the code into the Kahoot website or app and test your knowledge. Now take a moment, challenge yourself with this Kahoot, and come back after.
Nursing in the Middle Ages could have started as early as the 500s. Many roots of nursing were formed that we still see today. During the Middle Ages, the role of the nurse was broad as they cared for those with infectious diseases, injuries, and illnesses. Monks and nuns provided care to those in need, and religion was paramount in those days. Regardless of a person's religion or nationality, healthcare providers were obligated to help them when they needed. Supplies were provided by the Catholic Church as they were on the top of the social hierarchy with plenty of money and power. Healthcare settings varied depending on the location. In the country, monasteries acted as hospitals, whereas in the city, churches provided care for patients. Between the 500s and 600s, a hospital was built in Merida, Spain, and eventually more hospitals were established around Europe. Then around the 800s, many hospitals went into despair. In an attempt to remedy this, Emperor Charlemagne of Rome took action and restored the hospitals by filling them with the latest equipment. During the 10th and 11th century in Europe, monasteries housed hospitals, but began using separate infirmaries inside their property for religious individuals. During this time, nurses expanded their practice as their protocols evolved. They often had to go beyond general care services as they were expected to provide care as their patients requested. In 1200 to 1600s, Germany opened 150 hospitals where priests assisted nurses in patient care. By the 17th century, the monasteries closed down, but the Catholic religion still remained in control of healthcare. As the 18th and 19th century approached, middle-age nursing began to shift into the next era of nursing.
Florence Nightingale is considered the mother of modern-day nursing, who transitioned outdated practices to those that better suited the time. Also known as Lady with the Lamp, she was a British nurse and a monumental leader within the field who helped create the foundational philosophies for modern nursing. Nightingale was put in charge of British and Allied soldiers in Turkey during the Crimean War. She spent many hours in the wards doing her night rounds while providing personal care to the wounded. This established her image as the Lady with the Lamp. Her efforts to formalize nursing education led her to establish the first scientifically based nursing school. This school is the Nightingale School of Nursing at St. Thomas Hospital in London. Her work during the Crimean War was Nightingale's most famous contribution to nursing. Nightingale was a strong leader due to her effective leadership style. She motivated and inspired her followers to improve their practices by actively contributing to her patients' needs rather than simply directing others. This is a perfect example of transformational leadership in the sense that Nightingale is a leader that inspired her followers to one day become leaders themselves. Nightingale and her team of nurses were able to reduce soldier mortality rates from 42% to 2.2% in 6 months during the Crimean War. The lives of thousands of British soldiers were saved through Nightingale's good nursing practices and strong leadership abilities. Florence Nightingale's construction of a systemic and visual evaluation of nursing actions and outcomes resulted in major changes in nursing practice. Her work demonstrated the importance of observational research in nursing practice. International Nurses Day takes place annually on May 12th. It recognizes Nightingale and celebrates the important role nurses play in healthcare. Today's nurses are inspired by Nightingale through positive motives and determination she displayed during her time. In this way, she became a leader not only to the nurses of her time, but also the nurses of today. In 1857, Nightingale established what is called the Nightingale Fund. The purpose of this fund was to establish the nursing school known as Florence Nightingale School of Nursing and Midwifery to train nurses to practice similar methods to those that she used during the war. It is important to know who Florence Nightingale was because she shaped the nursing profession during her time. This created a domino effect which continues to affect us today.
The use of Florence Nightingale's practices when treating patients continued into World War I. The growth of the nursing profession from the start of World War I in 1914 to the start of World War II in 1939 was tremendous. As the demand for more workers in World War I increased, more women were accepted into the workplace. As medical assistance was needed, some women served soldiers fighting in the war, resulting in more recognition for nurses. World War I left an honorable legacy for female nurses as their vocation was seen as a necessity and was highly respected. The influence of nurses during the First World War was great, as 2,845 nurses cared for over 750,000 patients in 135 different medical units. They served all over Europe, but the majority served in France, England, and the Mediterranean. During this time, nurses mostly worked on the front lines or along evacuation routes to military hospitals where many were wounded. Nurses not only cared for soldiers in the war, but also cared for civilians as a new pandemic emerged. In 1918, the Spanish flu catastrophe placed a new value on health promotion and medical personnel because there were a vast number of illness-stricken people that needed health care. The devastating international consequences of this illness led to increased support for public health programs and the emergence of different healthcare delivery methods. As the nursing profession grew, higher levels of education were needed. Nurses now required university-level education. Western Canada had a considerable impact on this expansion, as the University of British Columbia and the University of Alberta were among the first universities to be awarded grants to establish nursing programs. Nursing continued to evolve as we enter into the World War II era.
World War II brought about many innovations that have marked the history of nursing. During World War II, there was an increased need for military medical personnel, so as a result, nurses enlisted. Known as nursing sisters, these women trained in Canada then went overseas to serve during the war, treating soldiers and civilians alike. They are now known as nursing officers, and they continue to serve with the Canadian Armed Forces Medical Service. As nurses were being called to enlist during World War II, a shortage of nurses developed in Canada. As a result, two nursing leadership styles developed that mirror those we studied in class. To make up for the lack of nurses, the activity-oriented functional nursing style emerged. Each nurse is assigned a specific task to perform on all patients, instead of caring for every need of an individual patient. Some advantages of this leadership style are that workers learn quicker and work is accomplished faster. Similarly, autocratic leaders enforce procedures that encourage rapid results. When decisions need to be made and tasks need to be accomplished quickly, autocratic or functional leadership is used. For this reason, functional leadership was effective during the war. In comparison, team nursing is when patient care is shared by the nursing team. Collaboration and encouragement between the team members are advantages of this leadership style, as it increases job satisfaction and improves patient outcomes. This emerging model of nursing is very similar to shared leadership as it distributes the responsibilities among the various members of the group. A lack of holistic care, continuity problems, and fragmentation of care are disadvantages that functional and team nursing share. Because numerous people are involved in patient care, miscommunication and inadequate patient care can result. Even though there are faults, we still continue to adopt aspects of both of these nursing styles today.
Before World War II, most of nursing education took place in hospital-based schools where students would exchange labor for nursing instruction. This contrasts today's programs where nursing students exchange tuition for instruction. Similar to today, World War II era nurses were expected to prevent the spread of infection, dispense medications, and keep order within their units. Most people thought the best way to learn was through experience. However, this type of education began to be viewed as ineffective and dangerous. Following World War II, expectations of nursing care changed. People were less willing to put their lives in the hands of nursing students. They now wanted fully educated nurses. Nursing education increased during and after the war, which led to exciting innovations and expanded nursing degree programs. In 1950, an expert nurse was someone who had risen to the top of the hospital hierarchy and knew how to solve problems through experience. Today, an expert nurse is an educated individual that has demonstrated that they are capable of solving problems and achieving favorable results.
The nursing profession has advanced greatly in recent years, as nurses strive to distinguish their role from other healthcare professions. There's a large desire to show the importance of nurses in the healthcare setting. A healthcare team consists of a number of different professions playing different roles in client care. Adjustments have been made to healthcare throughout history in order to provide better healthcare delivery to the public. There are many nursing roles seen today. Licensed practical nurses take and record vital signs, monitor progress, and report patient reactions to treatment, whereas registered nurses observe, assess, monitor, and document patient symptoms, reactions, and progress. They also administer medications and injections. Nurse practitioners hold more responsibilities as they conduct comprehensive health assessment and diagnose, treat, and manage acute and chronic health conditions. Registered nurses in particular play a key role in the health care environment as they are leaders in the delivery of holistic, client-centered care. They use the nursing process of assessment, diagnosis, planning, intervention, and evaluation to deliver care. This involves using critical thinking skills and knowledge. An advantage to being a registered nurse is that they can work in a variety of settings where they collaborate with patients, families, and other professionals. Nursing leadership is constantly adapting to the rapidly evolving healthcare environment to keep up with new innovations. This is reflected in the leadership styles that are commonly used in nursing today. One example is transformational leadership, where leaders have a vision and use their values to inspire others in a given direction. Another leadership style recognized in modern nursing today is servant leadership. These leaders are motivated to serve others while also sharing their power with everyone. In the healthcare setting, this leadership style is used to promote cooperation and intellectual stimulation by granting followers a sense of power. The use of these two leadership styles results in a high quality of practice environment where nurses are respected and are involved in decision making. One of the most significant changes to the nursing profession compared to the past is the requirement of a baccalaureate degree. It is for this reason that we are enrolled in a Bachelor of Science in Nursing degree program. Before we can become nurses ourselves, we must complete a cumulative comprehensive exam. In January of 2015, the first NCLEX was administered in Canada, which assesses the nurses' competencies based on challenging questions. It is through the development of the past that we now have nurses characterized by their provision of exceptional care.
If you didn't succeed with the first Kahoot, this is your second chance. Based on the information you've learned from this presentation, try your luck at the second Kahoot to see how much you've retained. Good luck! See you after.
For all of us as future nurses, it's important to know how the nurse's role has evolved over the eras because our practice today is based on the foundations and fundamentals of the past. Today's modern nurses are the product of ever-changing medical professions and demands. There are many aspects of nursing that have been erased from our practice. However, there are many characteristics of nursing that have stayed the same through the ages. These characteristics include the compassion we showed towards patients, the role models we become for patients, and the work ethic we display. As future nurses, we need to recognize that nursing is a respected profession that has come a long way from where it was to where it is now. It is a profession that will continue to evolve. From the church being in control to the world wars, medicine has been evolving to best fit requirements of the time. Many mistakes have been made over the eras related to healthcare. However, through changing demands, innovations occurred and lessons were learned, leading to effective practices and positive outcomes seen today.